So the YMCA education series is free and open to the public. So we encourage you to spread the word and invite family and friends to participate. We host approximately 8 to 10 of these programs each month, varying in all different topics. This program will last about an hour, and you might find that you have some questions during the presentation. We'll be happy to address these questions at the end of the program. You can also add them in the chat. If you have a question, you can simply type it in the chat section on your screen, and I will relay this question to the speaker at the end of the program. You may also raise your hand and ask a question yourself if the chat button isn't working for you. I ask that you please keep your questions general, and we will do the very best to address them in the time allotted today. Thank you again for joining us today. And now I would like to introduce you to Maureen Rafa. Maureen is a board-certified psychiatric mental health nurse. She's currently working as an elder care coordinator for the law offices of Stephen Sutera, an elder law attorney. Maureen is experienced in mental health, geriatrics, managed care, home health, and hospice. She helps clients navigate healthcare and aging in place by connecting the clients with equipment and services for their home or assisting in the transition to senior living facilities. Maureen can also be hired independent of the attorney of the law offices. So I'm going to turn my camera off and we'll start the presentation.
Thank you, Anna. Good afternoon, everybody. Thanks for joining today. I just want to let you know that this is kind of has a lot of information, so it may trigger some questions for you, and hopefully it'll answer some questions you might have already. And just realize that caring for someone with dementia feels like wandering into uncharted territory without a flashlight. And a little quote from Rosalind Carter, a former First Lady. She said, "There are 4 kinds of people in the world: those who have been a caregiver, those who are currently a caregiver, those who will need a caregiver, and those who will be the caregiver in the future." Next. Oh, Anna, you have to advance the slide, hon, when I say next. Oh, thank you. So briefly, what are some signs of dementia? Well, memory loss that disrupts daily life, recent events or learned info, challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships. Or if they're still driving, they might have more fender benders or trouble with parking. They're hitting the curb all the time. New problems with words in speaking or writing, not just misplacing things, but the inability to retrace their steps. Decreased or poor judgment, and less attention to their grooming, and maybe they start withdrawing from social activities. There are actually 16 million family caregivers caring for loved ones with dementia in this country, and 18.5 billion hours of unpaid daily care, or 233.9 billion hours per year. 66% of caregivers actually live with their loved one, and over 60% are caring for their parents and children at the same time. And 30 to 40% of dementia family caregivers suffer from depression, compared to 5 to 17% of non-caregivers of the same age. Next. So dementia is a progressive brain disorder that makes it more difficult for the person to remember, think clearly, and communicate with others, as well as take care of themselves. It can also cause mood swings and a change in their personality and behavior. There are many types. Some people will say as many as 400. but Alzheimer's is the most common as it's 60 to 80%. However, vascular, frontotemporal, and Lewy bodies are a little less common, but certainly prevalent. Not all people with dementia experience the same behaviors or all behaviors that we will discuss today. And another tip to remember: as the illness progresses, age regresses. In other words, the person gets younger and younger in his or her brain. And that's one reason they don't recognize spouses or children, because they may not be of an age where they know that husband or had the children. So you kind of need to know and check in with them periodically and ask them how old they are in order to communicate more effectively. And then kind of talk about what was important to them at that age. Next. So in normal aging, there are changes in all 5 senses that start around the decade of the 50s. But dementia can add to those changes or deficits. With vision, they might lose the ability of the brain to interpret images, which adds to increased confusion, the inability to recognize the familiar faces and places. It impairs the ability to discern colors and shapes, and need to know color contrast. In other words, the color of the table from the dishes you're putting on the table, so they can see that there's dishes there. Smell is often the first to be impacted. They either confuse odors or lack a sense of smell. So you kind of need to keep outdated, spoiled foods cleared out. And of course, taste is always impacted by smell. And so they could end up eating spoiled foods because they may not taste it. And with hearing, it may be okay, but they're unable to process certain sounds. So a calm, quiet environment is optimum. A high-pitched female voice is harder to distinguish, like words that kind of sound alike, like mine and fine.
This is something you have with me.
And touch, they may not feel the hot or cold changes. So it's good to color code the faucets with warning stickers so they don't burn themselves.
We're talking about Alzheimer's people.
No, dementia.
Next. Okay, so some 10 tips for communicating with people and in the approach of their care. Next. Your attitude and body language. So you want to set a positive mood for interaction. In other words, kind of be present for them, be cheerful, speak in a pleasant and respectful manner, show feelings of affection with your facial expressions, your tone of voice, and physical touch. And depending on the day or the time of day or what else is going on, this could be harder than it actually seems. Next. You want to get the person's attention when talking to them. So limit distractions and noise. Turn off the TV or radio. Close the curtains. Shut the door or move to a quieter place. Before speaking, address him or her by name. Identify yourself and your relation, especially if you know they're having trouble recognizing you. If she or he is seated, get down to their level to maintain eye contact. Don't be hovering over them, and never come up to them from behind. And people may not understand always what you're saying to them, but they understand your tone and body language. And sometimes you may not understand what they're trying to say, but sometimes it's just easier to pretend and just be friendly, calm, and respectful. Next. So state your message clearly. You want to use simple words and sentences. Give only one direction at a time. Speak slowly and in a reassuring tone. Refrain from raising your voice. Oftentimes it's not that they have a hearing problem. They're just having trouble kind of integrating and understanding. So if need be, repeat the same message or question. Wait a little bit. If they still don't understand, then wait a few more minutes and rephrase it. But on the second attempt, don't rephrase it. Use the names of people and places instead of pronouns like he, she, or they, and that might help them understand who or what you're talking about. And try to listen actively and focus on a word or phrase that makes sense to you. Next. So when you're asking the simple questions, again, you want to ask one question at a time, and it should have a yes or no response. Don't give too many choices. Examples, would you like to wear your white or blue shirt? And visually show them the shirts while asking. Or do you want macaroni and cheese or a ham sandwich for lunch? Next. Listen with your ears, eyes, and heart. Be patient in waiting for a response when you've asked a question. They might have some word retrieval issues. If they're struggling, it's okay to suggest a couple of words and then watch for nonverbal cues. Are they pointing to something? And strive to listen for meaning and feelings that underlie the words. Managing tasks. Break down activities into a series of steps. Sorry, I didn't say next. Break down activities into a series of steps. Encourage them to do what they can still, and remind them of steps and assist with the steps he or she is no longer able to accomplish. Use visual cues such as showing him or her with your hand where to place the dinner plate on the table, for example, if you're asking them to set the table. And as the dementia progresses, you want to put one food item on the plate at a time. You know, early on, it's okay to have a regular plate with all of your dishes on it. But later, it can be confusing. So just one food item at a time. And you might have to remind them or demonstrate how to use the fork. And again, if it's progressing and they're not able to use the utensils, they don't remember how, they can't coordinate it, provide more finger foods, chicken nuggets, cut up hot dogs, some fruit or veggies cut up. Think of things that they like to eat. And this, of course, is if they're still okay to chew and swallow without coughing, without aspirating. Because as the illness progresses again, they will most likely develop some swallowing issues. Next. When the going gets tough, if your loved one becomes upset or agitated, try changing the subject, try changing the environment, maybe move to a different room, or if the weather's nice, you go outside, suggest a walk, or state, I'm sorry you're upset, let's go get something to eat. The idea is you want to distract them and redirect, and maybe that will help calm them down. Next. Respond with affection and reassurance. People with dementia often feel confused, anxious, or unsure of themselves. And in the early stage, they may even be depressed because they recognize that there's something wrong and they're not remembering. And it's scary. They may recall things that never happened. They may start accusing their spouse, if they have one, of having affairs that never happened. They may become suspicious or paranoid and accuse others of stealing. This is very common. You don't want to try to convince them, you won't win. So you just stay focused on the feeling they're demonstrating and respond with comfort and support. Sometimes holding hands, hugging, or praising will work, but you have to know your loved one. If they're not a touchy-feely, huggy kind of person, that may actually set them off more and not calm them. Next, remember the good old days. Many people with dementia may not remember what happened 45 minutes ago or 5 minutes ago or what they had for breakfast. However, they can remember their lives 45 years ago. So you want to avoid asking questions that rely on short-term memory. Ask about the past, share old photos. This is kind of called reminiscence therapy. So it's talking about their life when they were younger. Did they have a career? Were they raising children? What were their interests? And focus on remembering and discussing those things. Next. And try to maintain your sense of humor. This is a very challenging role to be a caregiver. but it's very important because it's so easy to lose it. Use humor whenever possible. Say things like, I do silly things like that sometimes, kind of take the pressure off of them. And you're not laughing at them, but with them. They may still have some social skills, especially early on, they will, and can laugh with you. Both of my parents had different types of dementia, so I've not only cared for people professionally, but also personally. And I can't remember, my parents have been gone quite a while now. I can't remember what we were talking about one day with my mom, but my response to her was, Mom, do you have a direct connection to God? And she just started laughing because she realized whatever she had just said didn't make a whole lot of sense. Take a break when you can. Watch comedies. So important. Next. Handling troubling behavior. The greatest challenges are the personality and behavior changes that can occur. One can best meet these by using creativity, flexibility, patience, and compassion. Patience is probably the most important because it's the hardest to maintain. Don't take what they say personally. They would probably say the same thing no matter who was with them. And as mentioned in the last slide, maintain your sense of humor. And believe me, they're not doing or saying anything on purpose to aggravate you. The brain is misfiring. This is crucial to remember. I cannot tell you how many times I've heard families think that and say that. They're convinced that they're doing it on purpose. They are not. Next. We cannot change the person, but we can try to accommodate the behavior, not control it. You can't control it. If the person insists on sleeping on the floor, put a mattress on the floor. Or if they want to sleep in their lounge chair, let them. Provide a pillow and blanket. We can change our behavior, though, or how we react, excuse me, which can result in a change in the loved one's behavior. Next. Behavior has a purpose and is triggered. So check with the doctor when a sudden change in behavior occurs. Because sometimes it could be an infection, like a urinary tract infection, and that will bring on much more confusion and difficulty. Or is it pain that they can't tell you? The UTIs as we age, no matter if you have dementia or not, become much more common. And my father-in-law did not have dementia, but one day he just had a sudden onset of confusion, and his turned out to be a tooth abscess that got treated. Are they hallucinating? This can be common, especially more common with Lewy bodies type dementia. But they can have visual, auditory, or tactile touch hallucinations. There may be a need for medication adjustment. And if they're taking out clothes from the closet every day, maybe they need to be busy. Can they fold laundry? Can they sweep the floor? Are there some tasks that will make them feel productive? And triggers can be something someone said or did, or was there a sudden change in the environment? Again, you want to try and disrupt and take a different approach. Like if somebody's biting, place a towel. Like if they're trying to bite you, place a towel on your shoulder wherever they're trying to bite, or wear a jacket or gloves. Or if they're able and will keep a plastic mask on them, better yet, give them like a teething ring to bite on. Pinching and grabbing and scratching, give them something to hold on to, like a rolled washcloth or a stress ball or a rag doll. Or maybe you could get gloves on them, or mittens, better yet. If they're hitting, again, try to distract with calm music, kicking, keep them in bed while you're getting their clothes on and their shoes. And it's harder for them to get you than when they're sitting in a chair, because you can control their legs a little bit better. Next. So addressing pain. Could just be facial expression, right? It may be your only indication. Clenched teeth, tightly shut eyes, biting their lower lip, frowning, guarded posturing. Maybe they're moaning or whimpering. They're just restless, more restless than usual, or sudden quietness. Now, with my mom one day, she just kept saying her leg didn't feel right. She couldn't really articulate other than it just doesn't feel right. And she was having trouble walking and actually bearing weight. So, of course, I took her to the emergency room and she had a blood clot in her leg. So she was admitted and they addressed that. So, you sometimes just have to play detective. Next, wandering. People with dementia walk seemingly aimlessly, but it may be boredom, it may be a medication side effect, or they're looking for someone or something. They may want to go home, like their childhood home. This is a good time to ask them how old they are. My mom was going home every night and always packed a few things in a jewel paper bag. And she was at the home she had lived in for 50 years, but she was going back to her mom. She was convinced her mom was waiting for her at home and it was getting late. And we would pretend even to have conversations on the telephone, pretending to be her mom. They may be hungry, they may be thirsty, or they need to use the toilet. So it's trying to get to know their behaviors and their needs and what they mean. Next, managing the wandering. Make time for regular exercise. If their balance is impacted, you can do chair exercises. Install new locks that require a key. Position them high or low, but not at eye level. Mask the door with a curtain or place a stop sign on it. Or place a black mat on the porch because it may seem like a hole they won't want to cross. Do you have a home security system? Put away their coat, purse, or glasses if you can and if they let you. My mom always had her purse with her. Have them wear an ID and have clothes with ID in them. Tell the neighbors and police that you have a wanderer. And we now have a silver search alert, just like the Amber Alert for children, so people can be out looking for them if they've wandered off. Incontinence. Well, as the dementia progresses, loss of bladder and bowel does occur. Some may have it even before the dementia. It's not that unusual as people age, even without dementia, to have incontinence issues. They may also forget where the bathroom is. Try to establish a routine for using the bathroom, maybe every 2 hours. Schedule fluid intake around the schedule. Obviously, we want to keep them hydrated, but you might want to limit the number of ounces in a day, and especially have the fluid intake earlier in the day and not as much in the evening. Use signs for the bathroom, even use a bedside commode close to their bed. And it's easier, they can get to that faster, but be prepared that you may be changing bed linens. And there are pull-ups and adult diapers, but they do need to be changed as needed. And you want people, when you're doing this much care, to have clothing that is really easy to remove. It has elastic or Velcro, and of course, washable. You don't want to be putting dry clean only clothes on. Next, verbal outbursts and threats. Cursing, arguing are expressions of anger or stress, or not. People that never swore may now do so with no real reason or explanation. React by staying calm and reassuring. Try to distract or redirect their attention to something else. Maybe a household chore they can still do as it makes them feel useful and productive. Baby dolls to hold, especially women, and if they've had children, or they just seem to be the nurturing type. Plastic tools, maybe for men who were handy or worked in the trades. And pet therapy. Now, taking care of a pet, of course, it has its challenges, but there are now some robotic pets for around $100. You can get them on Amazon because you can get everything on Amazon these days. So it's much less expensive than a real one. There's no veterinary fees, and they're ageless. And actually a company called Ageless Innovations, the Joy for All line, have these robotic dogs that I'm told, I have not purchased one, but I'm told they look pretty real. But you don't have to clean up after them either or feed them. It's just a matter of someone to cuddle and snuggle with and pet. Next. Sexually inappropriate behavior can happen sometimes, not with everybody. They might be masturbating or undressing in public or just making lewd remarks, sexually aggressive behavior, but the disease is causing this. However, sexuality itself does not disappear just because someone has dementia. So you want to think about it and develop an action plan before it happens, and just provide privacy if you can. You can allow, masturbating if they're not hurting themselves. My father, for instance, started watching the Spanish station soap operas because the characters dressed rather provocatively. He didn't understand a lick of Spanish, never took it, never spoke it. So it's just difference in their behaviors from what you've seen before. Next. Hallucinations and delusions. This is usually mid-stage to later stage. Hallucinations are seeing, hearing, or feeling what others don't see, hear, or feel. Delusions are false beliefs, such as someone is trying to hurt them or kill them, or believing someone is in the house other than them or you, accusing someone of stealing money or other items. Do not argue or try to reason with them because you won't win. They can't reason. Therapeutic fibbing is what we call this. You go along with the delusion, but you distract to calm them down. You can say reassuring things to them. Keep rooms well lit or explain the noise they think they're hearing. They may need medication with antipsychotics. These are also known as a major tranquilizer. They're prescribed meds just to help reduce the hallucinations, the aggression, the delusions. Next. Repetitive speech. It's harmless to the person with dementia, but annoying and stressful to the one providing care because they keep asking every couple of seconds the same question. Provide reassurance, distract with a snack or activity, avoid reminding them they just asked because they truly don't remember they just asked. Try to refocus them by asking them to help you. Don't discuss upcoming plans till it's time. My mother kept asking me whose wedding we were going to. I was actually taking her to my nephew's confirmation. So I just kept saying, we're going to Ryan's confirmation, Mom. We're not going to a wedding. So we get to the church and she sees my younger sister. And she said, you didn't tell me we were going to Denise's. And I laughed. I said, no, you're right, Mom, I didn't. But she didn't connect that Ryan is Denise's son. And so she didn't have that relationship down at that point in time. That's why I say you just got to maintain that sense of humor and the patience. And post signs about time for meals, or if somebody else lives there, when they're going to be home, if that's what they're asking. And just try to learn their behaviors and triggers. And I just have another note before agitation. When they become suspicious, jealous, or accusatory, it's unsettling for everybody. But again, do not argue. If money is missing, maybe give them a small amount to keep in their pocket or purse. Help them look for missing items. Find out their hiding place for missing items, because they may stick to the same places where they put things. Know that this is to be expected. And if they believe someone's in the house and they're calling police, try reassurance. Say things like, stay with me, or I'm not going to let anything happen to you, or nobody's going to hurt you. And does this occur more at night? Part of sundowning. Maybe try to keep the phone away from them during that time. And notify your local police that this is happening, because otherwise, the police sometimes can get annoyed, right, with those calls. So agitation, this can be from sleeplessness, irritability, exhibited by verbal or physical aggression. This usually does get worse as dementia progresses. Some triggers may be when they feel control is taken away from them, or fear or fatigue. If you reduce the clutter, the noise, and the number of people, that may help. Maintain structure with routine. Reduce caffeine and sugar, but they do love their sweets. People with dementia will pick those sweets over the healthy food every time. Use music, reading, walking, and reassuring, and those pets again. Distract with an activity or a snack. Coloring can be very therapeutic and calming. Remember the old-fashioned sewing cards? That's something that keeps their hands busy too. Or have them try to untie knots. Maybe it's just rubbing lotion on their hands, providing them with a simple manicure. Read to them if they liked poetry or they had a favorite book or nursery rhymes. They might even start reciting those because that's kind of an old memory. There's therapy putty or just plain old Play-Doh, especially if they were bakers, and you can get those kids kits with the rolling pin and everything. Have them separate a deck of cards into suits. Try to catch the behavior early, the agitation, and then the interventions may work even better. Concentrate on the process though, not the outcome. This is just a distraction. We're not looking for perfection or their ability to do it. Take a ride in the car, just like you do with small children sometimes, right? It puts them to sleep. They can take a nap, roll yarn, sort socks. I mean, there's a lot of things you can be creative with. And think of seasonal things. You know, in the fall, you can be decorating pumpkins. You help decorate cookies for Christmas. If they, have a favorite pie, you can just have them help make the pie. Things like that. Next. There are some alternative treatments. CBD oil, it does not have the THC, which is the ingredient that gets them high, but there is medical marijuana. They are actually having great results with agitation. It is expensive because it's not covered by health insurance or Medicare. Not acupuncture is listed in the literature. I'm not sure how well this would be received by some people. But I guess it's worth a try. Massage therapy, or sometimes it's just that simple old-fashioned back rub, because not everybody responds well to touch. So you have to know your loved one. And just because something works 1 hour or one day doesn't mean it will the next. So sometimes you have to try different things from time to time. Next. Dressing the person. Use loose-fitting clothing, as I mentioned, with easy zippers or snaps. Remove other clothing from the closet or drawers, thereby reducing choices. Lay out one outfit at a time, but no more than two. Remove soiled clothes. And don't argue if they want to wear the same outfit all the time. Just wash it when they're sleeping, just like you do with little girls that want to wear their princess dress every day. Try to help them stay independent as long as they can. Bathing is next. They often forget good hygiene. They may feel frightened or embarrassed having someone help because this is a private activity. What was their routine before? Did they prefer a bath or a shower in the AM or the PM? And how many days per week or on certain days? Remember, as we get older, we get drier, our skin gets drier. So they may not need a full bath or shower every day. You can use wipes or, just washcloth with soap and water to do, the pits, the private area. My father-in-law, he was not a great perspirer. He wasn't really doing anything that got him dirty per se. And his shower days were Tuesday and Saturday. That was his routine, and he never had an odor. Be sure curtains and doors are closed. Keep a towel over the parts not being washed if you're doing a quick bed bath or a sponge bath. Sometimes just sitting them on the toilet in the bathroom for the sponge bath. helps. And is the room temperature warm enough? Remember, people as we age get colder easier. We don't have the same muscle mass. Maybe we've lost some of our fat content. Do they have a favorite powder, soap, or lotion to use? Do they get their hair done at the salon? If they're able, continue to do that as long as you can. My mom was going to the salon once a week and getting her nails done before she had her stroke, which kind of stopped that. Non-slip mats and grab bars are important. Shower chairs, a handheld shower. It's much easier to be rinsing them. It's not that strong force coming at them from, the fancy head ones. And that way you don't have to have the big spray on them at all times. And it's not uncommon for them to have a fear of falling as the dementia progresses. And try again later or another day if they're that agitated and fighting. Next, eating. Well, people sometimes forget to eat or drink or how to eat. Do they have dental issues? If they've lost weight and they have dentures, are they too loose now and uncomfortable? You want to make meals and snacks part of their routine. Sorry. Turn off the TV, make it special. Use finger foods and, sorry, I have a tickle. And sippy cups if needed, just not the children's. Eat with them. If they're having trouble chewing or swallowing, adjust the diet to chopped foods, even pureed. Use thick liquids or soft foods. You want to avoid aspiration, which can lead to pneumonia. Are they losing weight? You can use Ensure or other supplements on the market, or just a good old-fashioned milkshake. They will always, like I said, pick sweet treats and food first, and it's okay. And remember, they're also getting fluids from ice cream, Jell-O. Anything that melts at room temperature is considered a liquid. Popsicles, if they like those. Next. Sorry. People with dementia may become uncooperative and resist bathing, dressing, and eating. They may feel out of control, rushed, or just afraid and confused. Allow plenty of time. They can't move or do things as fast as we do. Reassure, break tasks into steps, and find ways that can assist. This is their way of coping. Next. Sundowning. That's the restlessness, agitation, more confusion, the going home syndrome. It all starts by late afternoon or evening, and it's caused by changes in their biological clock, confusing their nights and days. So try to increase activities and avoid inactivity and napping too much during the day. Try to stop the caffeine, the extra sugar, provide smaller meals, plan for more quiet later in the afternoon and evening. Maybe turn on your lights early and close the curtains so they think it's darker than it is. Make sure your house is safe, block the stairs, have the locks on that are needed. If they have medication to help with this, continue to give them that. And you just may need more help at this point in time because the caregiver needs sleep also. Next. So just some reminders again from the Alzheimer's Association. Never argue, instead agree. Never reason, instead divert. Never shame, instead distract. Never lecture, instead reassure. Never say remember, instead reminisce. Never say I told you, instead repeat. Never say you can't, instead say what they can do. Never demand, instead ask. Never condescend, instead encourage. Never force, instead reinforce. Next. Behavioral management. So cognitive, emotion-oriented interventions are reminiscence that we already talked about, and validation therapy. Validation is similar to reminiscence, but you might focus more like on their career, something that made them feel accomplished. Maybe, being a parent. And you can talk about, like I said, music, movies, look at old photos, ask them about their first kiss or their first date, how they met their husband if they got married. Pet therapy we talked about, and also exercise we talked about, but it should always be like with a small group of people, not overwhelming. There's also some sensory stimulation like aromatherapy. You can get a diffuser and put lavender or lemongrass, some calming essential oils in it. Light therapy. This is you can get a nursery light at your big box stores. It's the same as the grow lights. They have expensive ones that they call for like seasonal affective disorder, but you can get the grow lights and they do the same thing, and they just sit under the light for maybe 20 minutes. Music therapy. Music gets to everybody no matter how advanced their dementia is, even when they're no longer speaking. And it's the music that they liked in their teens and early 20s. That's what they relate most to because we carry that music throughout our lives. Very, very effective and powerful tool. It's been good. Music's been shown to increase awareness, cognition, and engagement, reduce the agitation, anxiety, and other negative behaviors, reduce pain, boosts the immune system, improves sleep, elevates mood, and again, play their favorite music. And sometimes people that aren't speaking anymore will start actually singing to the music. That has happened. Next. Next. End of life care. Dementia is an end stage condition. Palliative care and hospice are available. Unfortunately, only 11% are referred to hospice with this diagnosis. As long as a doctor can guesstimate that they have 6 months or less to live, somebody, and their independence, their activities of daily living, they're really needing total care. They're already having trouble with eating. These are kind of the times that you're going to think about hospice. But what does your loved one want? Were they able to verbalize that, before the dementia advanced too far? Because most people do want to die at home or whatever their home is now. And if possible, it should be honored. Hospice care is covered by Medicare and commercial insurance, not their living arrangements. In other words, their Medicare isn't going to pay for the nursing home at this point. They're just paying for the hospice team to come in and provide that care. And most assisted living nursing homes allow for this and have contracts even with certain hospice agencies. Hospice, again, is comfort measures, not cures, and there is no cure for dementia. But it's a support team of social worker, spiritual, music, nurse, an aide, and they have the medications to help reduce anxiety, agitation, keep pain under control. Next. There is help and care for the caregiver. The Alzheimer's Association hotline. They also provide some caregiver support groups, and that number is 800-272-3900. Try to corral family and friends to help if finances are limited. If the person has funds, spend the money on their care. Hire a caregiver because this is their rainy day that they saved for. There are community resources depending on where you live. I'm assuming most of you are up in the North Shore. If they're in the city of Chicago, it's Department of Aging. Catholic Charities is all over the territory, and most areas have senior services available to them in the suburbs. An elder attorney if the dementia is early, to be sure documents are done and signed. Powers of attorney, living will, any estate planning needs to be done early while they still have decisional capacity. Otherwise, it may lead to guardianship if you don't have all the family members on the same page with the plan and the next steps. You can hire elder care coordinator, or there's also geriatric care managers, because we help people navigate, work with the MDs, work with the family, get them resources, provide a lot of education and support to the client and the family. And respite. There are facilities that are available if other family aren't available to help, so that you as a caregiver can have rest. And then you may need to think about time for placement depending on what's happening. And try not to promise that you'll never place them, because behaviors or a lack of funds may force you to do so. Next. There is a caregiver's bill of rights to take care of themselves, to seek help from others, to put their oxygen mask on first, so to speak, to replenish themselves, to maintain facets of their own life, to get angry, depressed, and express difficult feelings occasionally. Just try not to do it to the person with dementia. To reject any attempt by my relative to manipulate me through guilt, anger, or depression. To receive consideration, affection, forgiveness, and acceptance for what I do from my loved one, as long as I offer these qualities in return. To take pride in what I am accomplishing and to applaud the courage it has taken. To protect my individuality and my right to make a life. I consider them heroes, but they don't necessarily always think of themselves that way. But sometimes you just need to check in with the caregiver to ask where they're at in this journey. Or maybe it's just talking about something else in their life. Open-ended questions, though, so that they have a chance to verbalize. And if the family happens to hear something, if you do have another caregiver in the home, tell that professional what they said when it's a compliment. And if you know somebody that is a caregiver, learn about the patient's symptoms and progression. Give the caregiver a break. Run some errands for them, or sit with the patient so that they can run the errands or go to the MD. Maybe you just have a phone team to check in with them, and be specific about what you can do and when you're available. Next. Resources. There are a ton of books out there. The Alzheimer's Association definitely has all kinds of resources listed. But these are some of the books that are good. My Two Elaines, Creating Moments of Joy. The 36-hour day has been around for a long time, but I believe it's still very effective. Patricia McClure Chessier has written a couple of books. Losing a Hero, The Story of Pearl. It's a book she wrote about her mom. And also A Caregiver's Guide for Alzheimer's and Dementia, 9 Key Principles. There are studies out there if you want to go that route. Rush is certainly one place. There also, we're doing a Rush, a caregiver research, and you can always call 312-942-6996 to see if that's still going on. Great Lakes is another place that does some studies. The other thing I'm recommending, because I just finished this book, I don't know if you can see it. It's called Speaking Our Minds, What It's Like to Have Alzheimer's. Lisa Snyder is the author, Snyder. She was a social worker, and she actually interviewed people in their early stages. And it's so enlightening, because they are aware, they know they have the illness, and they share, their thoughts and feelings and frustrations. I think it's just a wonderful book. So I'm highly recommending that one right now. Next. I think it's the end, right? Questions, comments, Somebody has a shared experience they want to tell.
Let's see.
Anybody have a question, comment, story?
I'm muted.
Yeah, no, you're unmuted. I hear you.
Okay, right. When you discuss dementia, do you ever discuss mild cognitive impairments?
Well, dementia does provide cognitive impairments. And in the early stage, it would be mild cognitive impairments. And sometimes you can have some mild cognitive impairments and it's not dementia. It can be caused maybe by a brain injury, a traumatic brain injury. Sometimes there's some behavior changes and even some memory deficits, aphasia from having a stroke. So it's not, when you say mild cognitive impairments, it's not necessarily just dementia.
Can you recommend any books to read on that?
On the mild cognitive, I don't have one off the top of my head, but I'll bet if you put that in Google and or even, there might be things at the local library.
I've looked. There's
Nothing? Okay.
not.
Yeah, I would try just Googling and just type in books on mild cognitive impairment.
Okay, thank you.
Sure. This is going to be a podcast. Catherine was asking us to remind them how they can get the recording. It's going to be a podcast and it's going to be on the North Shore YMCA website. Is that correct, Anna?
Yes, this will be on the nsymca.org, and you will just have to navigate to the virtual YMCA section for yes, the YMCA Adult Education Series.
Did everybody find it somewhat helpful at least?
Yes. I think caregivers are saints.
Yes, they are. It's one of the toughest jobs, next to parenting, right? That anybody will ever have.
Definitely. Most definitely.
And just being a caregiver in general, I think it's especially challenging with dementia, of course, but maybe somebody just has a chronic disease like cancer or congestive heart failure, but they just need all this care also. And so generally anybody being a caregiver for somebody who just can't do for themselves any longer, it's a very tough job.
Do you know much about palliative care for these dementia patients?
Yes, palliative care is separate from hospice, but it also can be included, or some people look at it as a stepping stone to hospice, but it's not always the case. So you could still be receiving treatment for a condition like a chronic condition and have palliative care. It's also covered by Medicare. And some people actually get better and don't need palliative care anymore. And other people will progress to where they need hospice because it is towards the end.
So does the doctor recommend palliative care to the caregiver?
You can ask the doctor. I would love to say that doctors would do that, but not all doctors are as informed about palliative and hospice care. Your oncologists most likely are, but doctors for some of the other illnesses, they may not be as quick. So it's, ask for the order.
Okay. I'm just seeing a couple of friends of mine suffering so much in caring for their Alzheimer's spouses.
Sure.
And I don't think anybody knew about that palliative care.
Okay.
Maybe be able to just give them some supports.
Right. And if, and if they have any chance of somebody else even coming in from time to time to help them, for them to even join one of the, caregiver support groups, even if it has to be online, if they can't get out. If that's possible.
Are those through like North Shore, or does the Y offer any?
I'm not sure if the Y offers any, but if there's a senior center in your community or just even the Alzheimer's Association, you can contact them and they will let you know where one is.
Okay.
The YMCA has a caregiver support group on Fridays. I'm not sure of the time. I believe it's like 10 or 10:30 every Friday, and it is free and open to the public.
Okay.
Excellent.
All right. That's the North Brooklyn. All right. This is very helpful information. Those are two great ideas.
I have a question. This is Kimberly speaking.
Sure.
My question is, are there any other tests, like definitive testing to show different things? My mother had a PET scan about 2 years ago, and the results at that time, they said, did not show patterns of Alzheimer's. I'm wondering if there are any other tests.
Well, the biggest test, if you want to say, and it's actually a series of tests, is the neuropsych testing done by a psychologist. Again, you can ask the primary care physician for referral. And that they are able to rule in and rule out. And so they can, based on the testing that's done, determine if somebody has a type of dementia. Yes, there are different scans. There's SPECT scans and PET scans and MRIs. And especially early on, they don't necessarily show. The definitive understanding still with scans is that Alzheimer's definitively is diagnosed after death. That's where your best bet is the neuropsych testing.
I had that done earlier this year, and I tell you, it was one of the worst experiences I have ever had in my life. It was scheduled to be a 3-hour appointment. I was there 5 hours and 40 minutes without a break.
Oh,
Now they offered to take a break, but I wanted to get the hell out of there. So let's just keep going.
Yeah, it's hard to sit through. Definitely they're hard to sit through. Sometimes they can break it up into a couple of different days, sessions.
And that's what I would suggest. I mean, I wanted this done as a baseline because I know I am going to be some kind of dementia. It's on, both my parents had it, and it's on other family members. So fine. Like I said, I wanted to know where I'm at.
Well,
But
just so you know, everything pretty much has a genetic influence, but not everybody, even with both parents, necessarily still get it. However, where it's more pronounced as a genetic link is when it's early onset dementia. In other words, they get it before age 65. So,
okay, well, I'm a little bit over that, but I know I have it.
oh,
I don't care
okay.
what anybody's telling me.
Okay.
I know it is there. Very mild, but
Yeah.
it's there.
Okay.
But anyway, I still would recommend the test with the caveat that when you make the appointment, you ask specifically, how many hours is it going to be? I will come for 2 hours maximum at a time.
Yeah, and I think that's an excellent idea and suggestion, and I can't imagine that they wouldn't even give you a break though.
Oh, they offered to give me a break.
But you didn't want it. You just wanted to get it done and over with.
I thought I was there for a 3-hour appointment. And at the time they said, and personally, one of the other reasons I didn't want to take a break is to make it that more miserable for the person testing, because that meant she couldn't take a break.
Okay.
Well, you know what? I think that's unconscionable that they've scheduled an appointment and it goes double the time.
Yeah.
That makes no sense to me whatsoever. And I complained all over the place about it. And everybody said, well, we're going to take this. And this was through North Shore. I might as well tell you. And they said, we're going to actually take this to heart and, really see if we can redo and rethink how we're doing things. But again, my thing is, talk, like you schedule the appointment, the doctor puts in an order, you schedule the appointment with someone. The scheduler just knows what they're told. They are not the person. You need to ask for the tester to get in touch with you to explain what could be done, how it can be broken up into segments to make it the most comfortable for the person doing it.
No, I think those are excellent ideas and suggestions, and hopefully you've picked the right person that's going to cooperate with that. Because it makes for a very, very long day. I mean, 3 hours is long enough, but 5 is really, really.
Oh, and you think that, by the time we were on hour 3 and I realized it was going to be long, I didn't develop a pretty bad attitude.
Mm-hmm.
Oh, yeah. They're saying, okay, for an example, one of the questions that you always get asked, do you know where you are? Yeah, I'm at Glenbrook Hospital Ambulatory. Well, where is it? What difference does it make? I'm here. I got here on my own. And you know what? Quite honestly, this may sound stupid. I did not know what city it was in.
Okay.
What do I care? I know how to find it.
All right.
And that's what I told them. What possible difference does it make? Why are you aggravating me with this? They said, well, the woman said, make a guess. Well, I guessed wrong.
Okay.
I figured it was Northbrook. But, again, in this testing process, there are things that do very much irritate you. And if you have too much of it at one time, it puts all your nerves on edge.
Definitely. Maureen, I wanted to mention that a number of people asked for your contact information.
Oh,
and
sure.
Also, Vicky, I think, has a question.
Okay. I know I should have my number memorized, but I don't. Hold on 2 seconds. I'm getting my card.
It was on the very first slide. Could we just go back to that slide?
Oh, sure.
Okay, you said it was on the first slide.
Pretty sure it was.
Okay.
So, right, my phone number is there, 708-857-7255. And my email, which should be on this slide, but it's not, is mrafa, R-A-F as in Frank, A, at suteralaw.com. That's S as in Sam, UTERALAW.com.
Could you repeat that?
Sure.
I see it now. Okay.
Oh, the phone number, 708-857-7255.
All right. The Steven Sutera.
Yeah, right.
S-U-T-E-R-A. All right. Okay. What does PMHBC stand for?
Psychiatric Mental Health Board Certified.
So do you do you work with families or the caregivers?
I do, yeah. The clients and their families to kind of, do a plan of care and figure out what other additional help they may need, what can they afford? Are they going to run out of money? As we all know, there's a big caregiver shortage, whether you're in a facility or at home, and they're very expensive. Our office is right down the street from Christ Hospital. That's why you just heard an ambulance go by.
So you're South Side? Is that South Side?
Yeah, I'm South Side. But he has an Oak Brook as well as an Oak Lawn office. But we always say, DuPage, Cook, Will counties.
Okay.
I do travel.
Are you covered by any form of insurance?
Unfortunately, my services are not. They're out of pocket.
Okay. Do you know generally how much it costs? If that's being offensive, I'm sorry.
No, it's not being offensive. I think it's a fair question. It's $160 an hour.
Maureen, also, Vicky had a question earlier.
Okay.
Vicky, would you like to unmute and ask the question?
Unmute.
Yes. Okay.
Can you hear me?
Yes.
Does dementia in itself cause death?
Well, it is an end-stage illness, so it will lead to death, yes. Usually, though, more times than not, they'll develop an infection, maybe from bed sores, or they get septic. A lot of times they develop aspiration pneumonia, but that's when you're really running it down to the bitter end. They're emaciated because they're not eating and drinking, they're not moving, they're bed bound. Even if you turn them, they don't stay in a turned position.
Okay, thank you.
Mm-hmm.
There was also a question in the chat of how does one find a good neuropsychologist aside from someone the neurologist recommends?
Okay, and I'll type the email for everybody. Well, if your own primary doctor doesn't know one, I'm sure North Shore, if a lot of you belong to the North Shore Medical Group, or you're part of up there, maybe Northwestern. I don't know if DuPage Medical Group has far north. I know they're west, and all over the place otherwise. Advocate's up north. You could try calling if you belong to a medical group, or just calling the hospitals like a Lutheran General, or what else is up north? Evanston Hospital. Is it still Skokie Hospital in
It's
Skokie?
orthopedic now.
What's it called?
Skokie, no, it's an orthopedic hospital.
Oh, it's
part
not.
of North
It's
Shore.
not general anymore. Okay,
It's part of North Shore.
part of the North Shore. You could try that and see if they give out recommendations. I mean, I know of a couple. One is out west. I don't have his number in front of me. I could probably email that though to the Y, and they can post that. I know one that's on the north side of Chicago. Again, I don't have her number handy, but her name is Sherry, Sherrie, all. She's actually with a group practice on the north side of Chicago. And I'll bet if we Google her, let me try Googling. So I know there are some good ones out there that would be patient, because they also need to be patient, right? And explain things. And, this is a very difficult to sit through. And the whole reason you're going, is to kind of clarify or determine for sure, right, that what you already maybe suspect or your family has suspected. Let's see, Sherry just wrote a book too. It's going to be out, I think in July. But I've heard some of her presentations. So yes, when I Googled her, she comes up. She's with Chicago Center for Cognitive Wellness. And her number is 773-345-3495. And that's to schedule an appointment.
How do you spell all? Sherry all? A-U-L?
A-L-L.
A-L-L. That's simple.
Does anyone have any more questions?
Wait a second, I'm supposed to do something here from someone. Can you please type the email? Oh, my email. Okay. mrafa@suteralaw.com. Okay, it's in the chat.
Thank you.
Mhm.
Thank you so much, Maureen, for speaking with us today. And this concludes our YMCA Education Series presentation. On behalf of the North Suburban YMCA and our Yes Series, we thank you for supporting our organization and programs like these. Thank you so much, Maureen. It was really educational, informational. Programs like this one are free and open to everyone in our community. So if you enjoyed today's program and would like to support the North Suburban YMCA, please consider helping with a donation at nsymca.org. We hope to see you at our next speaker series tomorrow, Tuesday, on the topic of meditation. It's our monthly meditation series. Tomorrow at 11:15. Thank you again and have a wonderful day.
Yes, and thank you for being such an attentive audience.
Thank you. It was
Very informative.
very
Very
good.
informative. Thank you.
Have a good day.